Men are being told daily that they're tired, unmotivated, maybe gaining weight, and they're saying, well, this is because of low testosterone. Well, how much of this is real and how much of it's actually marketing? I'm Nurse Healy. I've been a registered nurse for over 30 years. I've worked frontline in occupational health nursing, and I've got a little bit of experience, so maybe we can walk through this together. Let's say testosterone isn't just a muscle hormone. It influences your mood and your energy levels, how you sleep, your strength of your bones, your red blood cell count, even your metabolism, and yeah, of course, it affects your sexual health. But here's the truth that most men never hear. Low T is real, but it's not responsible for every problem that you have. Most symptoms blamed on low testosterone are actually caused by, well, your lifestyle, what kind of stresses you have, the quality of sleep that you get, and any underlying medical issues that you currently have. Real low T symptoms are loss of morning erections, difficulty maintaining an erection, all around low sex drive, reduced muscle mass, low energy, even after a good sleep, and feelings of depression. Some people do claim that they have loss of body hair, whether it be on their head or just on their body, but that's not a unanimous complaint that you hear of. These are not low T symptoms that I'm going to say next. And they're things that are simple like, well, I'm feeling stress, or I'm really sleeping poorly, dieting wrong, or your load from your work is just crushing you. If your life is burning you out, testosterone isn't the villain here. It's just your lifestyle, right? Now, if you have low libido and fewer morning erections, or your strength is dropping for no apparent reason, this is the time when you think, well, maybe I should get my testing done. Here's a couple of critical things, though. Testing needs to be done in the morning, and it needs to be done twice, ideally around 6 weeks apart. And the reason being because your levels will fluctuate, right? So you want to make sure that you get it. And I need to stress this, and this is very, very important, because no matter what your number is, so the magic number for classified as low T, the lower is 8 to 12 nanomoles, and that's what they say is the low end of it. But somebody can be sitting at a 10 and feel amazing, and somebody else can be sitting at 13 and 14 and feel completely depleted. So the numbers have to kind of line up with what you're acting like as a human being. So responsible clinicians will look at your blood work and then have discussions with you about how you are actually feeling. So that's why when you hear somebody says that, well, we can diagnose you with low T without doing any proper testing, you best just walk away from that right away. Testosterone replacement therapy, or what they like to call as TRT, it certainly is not a cure-all, and it won't fix your stress, it won't make you sleep better, it won't cure your burnout, and it certainly isn't going to help with your poor health habits. But it can generally help men with true low testosterone. The problem with it is once you start TRT, your own natural production often drops, and it may never fully return. So that's why TRT should never be prescribed after a quick online quiz or a 5-minute appointment with your physician. Here's how to spot when you're being marketed to and not medically treated. When you see an advertisement and it talks about, well, just answer these short quiz answers and we'll give you a diagnosis, or there's some kind of a promise of an easy fix, people like to guarantee results. And problem with this is you're probably never asked to submit blood work, and so if you're not diagnosed with proper blood work and they're not asking you questions about your sleep or your stress or what kind of alcohol consumption you have, they basically consider every man they see to have low T. Once again, that's high-level marketing. So good medicine starts with questions, never starts with assumptions. For most men, natural changes that happen in our lives when we make some differences by altering things like our sleep patterns, or for all of us, reducing some belly fat, and maybe starting some strength training, trying to lower what your alcohol normal consumption is, lower it a little bit, and finding better ways to manage your stress. Eating more proteins is always a good thing. Those can help to change your testosterone levels. But the problem is people aren't, we as a population of people, everything is immediate. Well, something like this will take like 3 to 6 months for it to actually initiate and show up in your blood work. So I urge you to be patient, right? So the topics that we discussed up top just a few seconds ago about changing some of your lifestyles, your belly fat, your alcohol, yada yada, those things can help reduce and restore your testosterone to a more healthy range. Once again, let's go back to the fact that this all takes time. So when your testosterone is truly low and the symptoms match TRT, that can be life-changing, but it requires the right supervision and the right medical reasoning. Look, I'm just Nurse Healy. I'm here to help you understand your health. I'm not trying to scare you, and I'm not selling you anything. I'm certainly not promising miracles. I can offer you truth and a steady hand. I need to say this clearly, that the information in this video does not provide personal medical advice, diagnoses, or treatment, and should not replace a consultation with your personal, qualified healthcare provider. Well, that's all the time we have for today. Please take time to take care of yourself and those that are within your circle. You're all worth the effort.